After thousands of patient visits, I started to notice something. The patients that finally got diagnosed after months of confusion did these three things that no one is talking about. Most doctors don't realize this, but these three things change everything. If you have a rare or complex condition, there are usually warning signs that things are not going well. Maybe you're being bounced from doctor to doctor. Maybe you feel horrible even though your labs are normal. Maybe you feel more confused when you leave the doctor's office than when you went into the appointment. Or maybe you start to wonder, will anyone actually believe me and what I'm going through? If any of that sounds familiar, this is the video for you. You see, the US healthcare system is not built for complexity. Doctors are expected to see more patients in less time, and they are paid based off of what they do, not whether you actually feel better. So even if your doctor cares, and most do, there's not enough time to think deeply about complex symptoms. When your doctor walks in, they're already juggling a dozen things. They're typically battling with insurance, they're charting, or they're responding to patient messages. They want to help, but they're human too. If you hit them with 10 different symptoms without a structure or a timeline, they will get overwhelmed. And that is exactly when patients are referred out or dismissed. So what do you do when the time is short and the stakes are so high? Effective patients do these three things. When patients are struggling with complex conditions, the visit typically goes better when they walk their doctor through their symptoms as if it's a story, not a list. Start by writing down all of your symptoms and pick the top three symptoms that are impacting your life the most. Then for each symptom, think about, when did this start? How long is this going on for? How frequently does it occur? What triggers the symptom? What makes a symptom better or worse? And what body part is affected? Then think of it like you're building a timeline. First, this happened, and then this happened, and now this is what's happening. But here's a caveat. If your symptoms have been going on for more than a year, it might be better to start with what's going on now and what the unresolved symptoms are now, and then work backwards. If you start too far back, there's a chance that your doctor could be distracted from what the issue is now. And why do I recommend that you focus on just three symptoms? It's because your doctor's time and attention is limited. If you present them with 10 symptoms at once, they'll be overwhelmed. So give them some time and space to think and analyze and ask questions. The second thing that effective patients do is that they emphasize change. And this is a powerful one because doctors are trained to detect change. It's what tells us that something is going on. So don't just say, I'm tired. Say, 6 months ago, I was able to walk 2 miles without any issues, but now, even if I walk a block, I get very winded. Or, I used to wear a size large, but I've lost so much weight that now I'm wearing a size small. Or, I used to climb stairs, but my legs are so weak that now I have to use my arms to push myself out of a chair. Change gives context. This is what makes vague symptoms real. It tells your doctor this is serious. The third thing that effective patients do is that they use clear, vivid examples. The more vivid you describe your symptoms, the more your doctor will be able to step in your shoes and understand what you're going through. It will help them connect the dots faster. If you say, I have 8 out of 10 pain, that means nothing to me. My 8 could be completely different from your 8. But if you say, my foot hurts so bad that when I stand up in the morning, my legs buckle and I limp to the bathroom. Now compare that to, I run every day and my foot hurts when I run, but I can still get through my run. These are two different situations, same body part, but completely different urgency. This is the cinema of the mind. Paint that picture in your doctor's mind so they can step in your shoes. So to summarize, if you're feeling stuck or unheard, try these three things in your next doctor's appointment. Number one, tell your story in order. Think timeline, not chaos. Number 2, emphasize change before and now. Number 3, use very vivid examples. Paint that picture in your doctor's brain. Doctors think in patterns, and if you use these techniques, it will help your doctor pick up the patterns. Now, you might be wondering, do I really need to go through all this work just so I can get decent care? Shouldn't my doctor be the one doing all the hard work? Yes. Yes, you're absolutely right. But the reality is that the system is broken, and even the best doctors are overwhelmed, and that is why you have to stand up for yourself. To help, I made a PDF cheat sheet that walks through all the things that we spoke about so that you can bring that with you on your next visit. The link is in the description below. If this resonates with you, subscribe. I have so many thoughts on this topic coming your way.